Let's go through what a labor room looks like and kind of like what to expect if you are being induced to the hospital and you're having an induction of labor. So they're starting your labor for you. When you arrive at the hospital, they will go through an admission process and then put you into a labor room where they'll scan your baby to make sure baby is head down. They're going to put baby on the monitor, and they're just going to look at the heart rate as well as your contractions. They'll put these little monitors on your belly. Make sure that you pee before you get these on, because once you have them on, you'll probably be in bed at least 20 minutes so they can get a good strip and see how baby's heart rate is doing. They're going to ask you to get in a hospital gown and undress from the waist down. So that means taking panties off too, just so they can do a cervical check. The next step is usually getting you an IV. And so they'll do your labs, whatever labs that your doctor orders, and start an IV. Always, always, always ask for a peanut ball. This really helps to keep the pelvis open in labor. Usually hospital rooms will have a breast pump as well as a bassinet for baby. In most hospitals, baby stays in the room with you at all times, unless there's other testing that needs to be done outside of the room. The hospital will provide dad sheets and blankets, but usually the pillows are limited in hospitals, so if you want to be really comfortable, bring your own pillow. In most rooms, there's a little rocking chair to sit in, and then this blue couch turns into like a dad bed, which is smaller than a twin, but at least it's somewhere to lay down and get some sleep. Most places use Cytotec, which is a little pill that can start your labor, or a cervical ripening balloon, which is what is shown here. This goes through the cervix, and one ball goes in the uterus, one ball goes in the vagina, and it's filled up with sterile water to put pressure on the cervix. Usually each ball is like 80 milliliters. Most hospitals have a birthing ball available, so ask your nurse for that. They'll provide towels so you can take a shower, peri bottles, pads, mesh underwear, and things like that. So don't worry about bringing that stuff to the hospital. Most rooms have neonatal resuscitation equipment in the room. So God forbid if something happens with baby and hospital staff needs to breathe for baby, all the equipment is readily available in the room. And if you do decide to get an epidural, you will have a fully urinary catheter placed because you'll be numb from the ribs down essentially, and you won't be able to get up to pee. Once your labor gets going, they will likely start you on fluids, and this is like the whole setup. Once you reach 3 to 4 centimeters, generally they'll start you on Pitocin. If you're GBS positive, they will run penicillin every 4 hours, and the goal is to get you in a good contraction pattern, contracting every 2 to 3 minutes, lasting 60 to 80 seconds. We want contractions close enough together and strong enough to cause cervical change, and then we'll reach 10 centimeters and push a baby out.